Wellness for Life is brought to you by Back in Motion Physical Therapy, Gottenborg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, and Lakeside Sports and Pain Clinic.
Hi, I'm Dr. Gottenborg, a chiropractor in Pelican Rapids, and today I thought I'd answer a few questions that I've heard come my way in the last 1 or 2 weeks. The first is people often ask me, why aren't these orthotics helping me, or arch supports, with plantar fasciitis? And here I have a fairly strong opinion. I believe oftentimes people are given these in hopes that the pain will go away, but there is nothing about the orthotic that will heal plantar fasciitis. There's some underlying problems that the orthotic addresses, and I tend to like to use the orthotic or arch support near the end of the treatment when people are feeling better. I think they're important, and I think they prevent reoccurrence. A second question, and perhaps one I've never answered before, is how does chiropractic help people with circulation? Blood vessels are very simple in that it is a wound muscle that is very sensitive to impulses from your nervous system, causing the blood vessel to dilate or causing an engorgement in blood, or to constrict, like, for example, when someone has Raynaud's. So Raynaud's will cause cold fingers. It may even affect the nail bed. It's a circulatory condition, but its cause is neurological from the upper thoracic spine. So by adjusting, or in a sense stimulating, that part of your nervous system, there's always a chance or an opportunity that you might be one of those people that respond. Another question I've got is when people come in and they admit that they have a problem with lower bowel gas, and in the same sentence ask me about Pepcid AC. And Pepcid AC might be slightly different, but it falls into the same circle of medications like Prilosec, omeprazole, Nexium. Anyway, what happens is, while they do a great job on stopping acid production, when the contents of the stomach move farther down, the environment changes. So now you have different bacteria that tend to flourish in a less acidic environment. And these bacteria tend to produce more gas. So what is the remedy? Well, find a replacement for Pepcid AC. And another simple remedy might be reculturing or re-inoculating that healthy flora. And you can do that by adding lactobacilli, which is a probiotic, which is also the healthy microorganisms that you could find in yogurt, for example. That would be a good alternative. The final question is in regards to the upper back, and this can be a tougher area, not necessarily to treat or manipulate, but on how a person responds. Partly today because a lot of our activities require us to bend our head forward. But people often ask, is there anything I can do, or why isn't the correction holding? And in the example I have here, I'll use this to prove a point that things that make this more difficult for us is when there is a curvature in the upper back. This particular curve is a kyphosis. When you begin to see the curve bow side to side, it's referred to as scoliosis. Both of these curves put the upper back into somewhat of a weaker position and also expose rib heads. I tend to believe that when a chiropractor, when we adjust the upper back, the adjustment to the vertebrae does not always include movement to the rib head. So I strongly believe that in addition to making the adjustment to the spine, that we also have to take into consideration the position of the rib at that same level. I think that helps. I tend to find that it works very well, and it allows people to get better quicker and stay feeling better longer. If you have any questions about any of these 4 subjects today, or things that you'd like to hear in the future, please give us a call here in Pelican Rapids. Thank you.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gottenborg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, and Lakeside Sports and Pain Clinic.